Welcome to Brillians training video. Brillians is the new name for the application previously known as SupraVISTA. Today's topic is Lab Review in Brillians. Did you ever ask CPRS? Can you help me review abnormal labs and common lab profiles in 1 minute? That is not possible in CPRS, because 1. CPRS provides no way to display abnormal labs only by filtering out the normal labs. 2. It takes many keystrokes and mouse clicks to review the lab profiles and the individual labs. So, what is the solution? In contrast to CPRS, Brillians is designed for efficiency. It offers many ways to streamline lab data review. 1. You can review common lab profiles with one click. 2. With one click, you can filter out normal labs so that you can focus on the abnormal data. 3. You can get a list of labs which have been abnormal in the recent years, typically 3 years. 4. For each abnormal lab, you can review historical data with one click. 5. Users can define their own lab groups for their specialty-specific needs. 6. Users can copy and paste data from grids, which is not possible in CPRS. What is in it for me? Time savings, accuracy, and less frustration. Due to the large volume of lab data, it is easy to miss an important lab findings. The abnormal lab results get buried under the new lab data, and are easy to miss. Who scrolls down 200 lines of lab data during a busy clinic visit? In CPRS, the process to review lab profiles is time-consuming and frustrating. Further, the lab data is shown in a grid, which cannot be copied. A 90 seconds video, shown later in this presentation, demonstrates how easy the lab review should be. This slide shows how to open the lab review form. On the main form stop panel, click on the Lab Review button. This opens the lab review form shown on the next slide. The lab review form is designed for one-click access to the commonly needed lab data. The user interface items in the left pane provide easy access to 1. Common lab profiles, 2. Buttons to filter the lab data shown in the grid, 3. Easy access to shared and personal lab profiles, and 4. One-click access to common diagnostic tests. The user can instantly display the commonly used lab profiles by clicking the profile's name. The user can easily paste lab data in CPRS. Note that lab profiles are displayed in a grid in CPRS, and cannot be copied. To copy and paste lab data in CPRS, do the following. 1. Highlight the text to copy and paste. 2. Right-click over the highlighted text. The menu opens. 3. Click on the appropriate choice. Here is a reminder from Grandma. You must have a CPRS progress note, or addendum, open to paste the data. The data is pasted at the keyboard cursor position. This slide demonstrates the issue of too much lab data. When the user clicked on the Show All Results button, the grid shows 1020 lab results. This much lab data is impossible to review quickly and reliably. In this slide, the user clicked on the Abnormal Only button. With one button click, Brillians removed 75% of the lab data, so that the user can focus on what really matters. Now, the grid shows only 271 test results, which is 75% reduction in the data to review. When user clicks on the Abnormal Uniques button, Brillians makes a list of all the test results which have been abnormal. Along the right border of the form, Brillians displays the list of labs that have been abnormal in recent years, typically 3-year data. A click on the listed lab displays historical data. This way, the user can quickly review historical data about many abnormal labs. The user can display, or hide, this list using the buttons above and below the list. To paste lab data in CPRS, the user can select all rows, or only the desired rows, by dragging the mouse, or, with Control-click and Shift-click. To copy and paste lab data in CPRS, do the following. 1. Select the rows to copy and paste. 2. Right-click over a highlighted row. The menu opens. 3. Click on the appropriate choice. In addition to the efficiencies discussed so far, Brillians provides shared and personal lab groups. Like a lab profile, a lab group is a collection of labs we want to see together. Unlike lab profiles, the lab group filters the grid to display the lab tests in the group, and hides everything else. The bottom third of the left pane has two drop-down boxes to use the lab groups. The shared lab groups are defined by your VAMC, and cannot be changed by the user. The personal, i.e., the user-defined lab groups are created, and managed, by the user. The user interface is self-explanatory. To open the lab review form, click on the Lab Review button. The left pane of the Lab Review form displays list of the available lab profiles in the top third. User can quickly review the desired lab profile simply with a click. User can paste the lab data in CPRS. With a button click, the user can display all labs. With a button click, the user can filter the grid to display abnormal labs only. The user can display the list of the labs which have been abnormal, at least once in the recent years. The user can review the historical data about each abnormal lab, by clicking on its name in the list. The user can select desired rows in the grid, and copy and paste this data in the CPRS with a right click. The user can filter the lab results grid by using the drop-down boxes in the lower third of the left pane. The user can review other diagnostic tests, using the drop-down box on the bottom panel. As always, the best way to learn a new skill is to play with it. You cannot do any harm to the patient's medical record, or Brillians, by exploring the various features. So, please feel free to click around, open forms, and check out various features. Thank you for taking time to review this presentation. We have many informative presentations on YouTube. Please search YouTube for Brillians Training, or SupraVISTA Medical DSS. If you have any questions, please contact us at help.supravista@gmail.com.